The decreasing length of stay in overall in a stroke patient's care has certainly impacted their discharge dispositions, in addition to their follow-up after they leave and how they're cared for. We are seeing their decreased lengths of stay not just on the acute inpatient rehab unit, but even on in the acute care stay. So after a patient has presented to the emergency department and goes to a stroke unit, and they may stay there for 3 days or so. And so we on the inpatient rehab facility are actually seeing stroke patients much sooner than we used to see them, which is good and bad. It's good because we definitely get to get these folks up and moving faster, which is great. We find that that is better in terms of outcomes for people. But we also see more medical complications in terms of unmanaged blood pressures and just coronary or cardiac issues and things like that. So those are things that we have to manage on the rehab unit now that we didn't have to as much in the past. As far as discharge disposition is concerned, folks, after having been on a rehab unit for a prolonged period, many of them were able to go home and be cared for within the home because they learned many of the techniques and things that they needed to know in order to care for themselves, in order to have family members care for them as well. Now it's sort of a rush game. We definitely have to get people in, and from the day they come in, we start talking about discharge planning, and how to train family members. And just as we have been taking in stroke patients earlier, family members are taking in stroke patients earlier. So they're dealing with a lot of medical issues as well, that we might even deal with on the rehab unit. There are some patients that just can't get back to home, and so we have to look at other levels of care for them, including skilled nursing facilities or assisted living facilities. And so we're seeing discharges to those places as well.